Economist Amartya Sen says, empowerment of people comes from the freedom they enjoy, and this includes freedom from poverty, hunger, and malnutrition. This also includes freedom to work and lead a healthy life. Cuba spends the highest for its health expenditure, a 95% of the total GDP. USA spends 18% of its GDP on healthcare. So, how do we fare in this list? India spends just 4% of its GDP on healthcare, of which barely 1% comes from the government. This is somewhere even lesser than Nigeria, which spends 5% of its GDP on healthcare. This gives an overall picture of how India fares among other countries. In India, elections are around the corner and the parties are coming with their manifestos. But healthcare, which is in fact the most important to look into, has been completely sidelined. India's 12th five-year plan constituted the universal health coverage with the mandate of developing a framework for providing easily accessible and affordable healthcare to all Indians. But how it will be institutionalized is the question. Efforts to increase public spending after 2005 2006, including the adoption of NRHM, the expenditure increased only marginally to 1.2% of GDP in 2009 10. This results in poor quality of healthcare, which in turn results in high out of pocket spending. In 2007, according to World Health Statistics, India ranked 184 among 191 countries in terms of public expenditure on health. As per India's National Sample Survey Organization, it indicates that between 1986-87 and 2004, the share of ailments not treated due to financial reasons has increased from around 15% to 28% in rural areas. The contrast and the divide between the private and public healthcares have increased day by day, especially the quality and infrastructure. When we talk about quality, the quality of maternal care that is provided in India has increased marginally. India ranks 76th on the maternal and child care. Though the maternal mortality rate has improved from 212 deaths to 178 deaths per thousand live births, it's still a long way to go. The universal health coverage will have two ambitious plans: the National Urban Health Mission and free essential medicines to all. The National Urban Health Mission will spend Rs 22,000 crores and 28,500 crores will be spent on free medicines to all. It's not just about spending. At the same time, the goals need to be achieved. As said, public spending just accounts for 1.0% of the GDP. This should increase by 3% by 2020 and 4% by 2025. A major chunk is occupied by private healthcare entities. So, how are we going to coordinate between both public and private systems more effectively is the concern. Also, one aspect is that the health sector comes under the state governments. Though a huge support in the form of different schemes and measures are done by the central government, it always becomes a center state problem and it takes a lot of political angle at the cost of life.